around the ankle joint, he still got the swelling here, especially here, tenderness, okay, and so it's a ligament sprain. When there is no fracture, it is a soft tissue injury, ligament sprain. So the treatment of all closed soft tissue injuries: rise, rest, ice, compression, elevation. Okay, so the compression is given by Crepe Bandage. All right. So what we do, the patient lies down. You need an assistant to put a Crepe Bandage. He cannot put on his own. So Dr. Prathamesh is going to help me. So first thing is, we will elevate the leg for at least 3 to 5 minutes. Let all swelling go down. Okay. Let the blood drain to his heart. Now imagine 5 minutes are gone. The Crepe Bandage is always open like this from left to right, not like this. This is the wrong way. Okay. So all the I am a right-handed surgeon, so it will open from left to right, and we always start distally from the toes. Okay. So the Crepe Bandage started here, and reasonably good compression pressure that depends upon your clinical experience. And every new throw is covering 2/3 of the previous throw. This is how advanced. So when you reach a joint like here, the ankle joint, what you do? We can keep the heel open for walk because it's allowed partial weight bearing on the crutches. Where is crutch? Okay, that's that. It's not a crutch, it's a walker. Okay. So around the ankle joint, I have gone here, and again I will go back to the foot. So this is called fixing turn. Now this will not allow the Crepe Bandage to slip. So this is a fixing turn. So I'll go back here, cover this area which is swollen. Only the heel is kept open. Now this Crepe Bandage is small in length because it's an old bandage, but you can go up to the calf region, okay, and reasonably tight, and then इसका clip किधर है? Then you put either a clip or a tape, and the patient keeps the foot down, and then he gets up and does his whatever partial weight beating or non-weight bearing.